This is Roy Kessel on behalf of Sports Philanthropy Network, live at Radio Row, Super Bowl 59 in New Orleans. And we're very excited to have with us two special guests that are going to be part of Leigh Steinberg's Brain Health Summit tomorrow. Leigh has been a pioneer in the fight for brain health and fight against concussions and so much important work. And so we're glad to have both of you with us today. I'd love to have each of you introduce yourselves to our audience and give us a little bit of background on your work and what you're going to cover at the event tomorrow.
Thank you, Roy. Very nice to be here again with Sports Philanthropy Network. I was at the Brain Health Summit last year, and so I got to interview with you last year as well. My name's Dr. Komal Ashraf. I'm a neurologist at Mizzou MU Healthcare. I specialize in epilepsy and concussion, and have an administrator role as well. I'm medical director of our concussion program there, and then educator and try to innovate as well um, while I'm there. So it's a privilege to spread awareness about prevention and signs and symptoms, the importance of early detection and treatment options, because there's now so many multimodality things, many ways to treat and address and help to recover people from brain injury, get them back to the level of activity, doing the things they are passionate about as quickly as possible and as safely as possible. So happy to be here to share about that.
Fantastic. Thank you.
Hi. Yes. Thanks for inviting me. Super awesome to be partaking in this event. My name is Jasmine. I'm the CEO and co-founder of a company called Rejuve.ai, and we're building what we call an international longevity research network. So we're all about helping people to optimize with their health span to be healthier. And of course, mental health is one of the key pillars of health and wellness. My background is in health information management. I was originally working in medical coding, so translating the doctor's handwriting, so to speak, and translating that into how much the insurance claim was going to be paid. And I didn't think that this was impactful in terms of actually helping people get better in their day-to-day life. I was only just reading really depressing records about how they were getting sick and sometimes even passing away. So now I'm working to help people actually optimize their lifespan and their amount of healthy years that they have by simple interventions.
Well, you're both doing such important work. You were with us last year, right? The evolution and the speed of the change in the brain health sphere is dramatic. Things move really quickly. So give us a few things from your end that have really accelerated over the last year.
Yeah. So, advocacy, health literacy is very important to me. So I think that with every passing year, the education and awareness of brain injury and the impact that can have on someone's life has come to the forefront. We see it every game, in the news all the time about concussions, and so I think that that has really evolved over the last year. Is just more understanding, more openness, less denial. More acknowledgement of this being a condition that's out there, and also understanding that there's something that we can do about helping someone to recover. So in terms of health literacy, that's a big change in the last year, or evolution. In addition, in the scientific realm, there's a lot of research and innovation that's happening, whether it's a diagnostic tool, whether it's a medication option, and in diagnosis, I think that that's big area of growth. Imaging modalities, electrical activity of the brain, and then platforms to consolidate all of that information, which communication is key in everything that we do, right? So being able to communicate data from discipline to discipline to each other is really important. Using AI, using all of our tools is really important. So that has really tremendously grown. And then you talk about the prevention world, new training methodologies, strength, conditioning, fitness, the importance of that. Also, different tools for prevention, like helmets, evolution in those areas also. and understanding the condition, of course, whether it's biomarkers and blood work, or whether it's the electrical activity of the brain, the importance of sleep. All of those things were growing day by day, month by month, and certainly in the last year.
Well, you mentioned so many interesting things. I want to stay with you for just a minute and then we'll go to Jasmine. You mentioned all of these different things, right? I think one of the challenges is none of them happen in isolation, right? They don't stay in their sphere, right? Sleep impacts other things, diet impacts other things.
Yep.
Physical fitness impacts other things. And so when we look at this, it's really that whole sort of 360 view. Brain health is impacted by so many things, right? Other medications people may take for conditions that don't seem to be at all related to brain health. So how do you, right, as a clinician in the work that you're doing, how are you able to kind of assemble that mosaic of inputs?
Yeah. So the holistic approach is incredibly important. We are not siloed. We don't have siloed processes. So as a neurologist, we are, and in medicine, I think in general, we are curious beings. So we assemble all that information first and foremost by asking the right questions. I am an educator as well, so I have students and residents, and I tell them you have to ask the right questions, listen to the response, then ask the next question. So continuing to ask questions to assemble: how is your sleep? How is your mental health? Do you have pain? How is your cognitive functionings? And then list out different manifestations of problems in those areas. How is your movement? How is your sleep? And then on top of that, we have different diagnosis tools. And so we assemble those. We also get and to address a holistic approach, we need a multidisciplinary team.
Right.
And we have neuropsychologists, PT, OT, speech doing their evaluations. And those are all ways that we assemble the data.
Thank you. So you talked about Rejuve AI, right? I heard the words mental health in there. That's been one of the themes here all week on Radio Row. We've heard that from so many people. It's the number one thing we hear from athletes at all levels: youth, high school, college, pro, former pro. But we hear it out in the regular world, away from sports, right? High stress professions, law, medicine, finance. There's so many people that are now becoming much more aware of their overall mental health. So tell us how Rejuve AI impacts that.
So yeah, I guess to that point of the data aggregation, it is indeed about empowering everyday people to track all of their individual health signals and see how it's playing a role in their lives, like seeing what kind of factors today, cause their average heart rate, to be higher, or their heart rate variability, or their sleep to be really poor, and being able to drill down into those individual factors and be able to create an actionable pathway to actually improve that in a way that is not totally disruptive. I mean, everybody is not going to all of a sudden get on a crazy diet, tomorrow, or an exercise routine. But there are kind of simpler ways, and that's where the AI part kind of comes into play. Being able to learn the data that you're inputting on a day-to-day basis, and give you those little tips and insights across different metrics of health to optimize. We're tracking data, from watches like these, and people's own personal subjective measures and all sorts of things. And
Right. We all have the wearables, or we've got our phones that are never more than a couple feet from our body. They can track everything that's going on. But talk a bit about how you develop the vision for what you're doing, right? There's so many aspects of health, so many aspects of mental health, neural health. How did you come up with the idea for Rejuve AI?
So yeah, like Rejuve is born very much because I'm really passionate about just the overall living longer, healthier aspect. And so coming back to the mental health, it's one of those things where people that have mental illnesses have shorter lifespans statistically. So even though they might be in okay physical condition, if your mental health is not right, you can still be leading into other pathways that will shorten your life. And so that really is where the passion comes from, basically wanting to live longer and healthier, and see everyone else kind of having that same enjoyment out of things. I mean, even things like money, for instance, if you don't have your health, it becomes a little less valuable. So That's really and wanting to make a real difference in the world, as I mentioned before, instead of just calculating how much money your hospital stay cost, how to keep you out of there in the first place.
Well, and I think that's so important because we've talked about it a number of times this week, the impact sleep has, right? This is a bad week to kind of focus on that because
Right.
everybody's out running around and getting up early. But um, sleep has such an enormous impact. Diet has such an enormous impact. And when you aggregate all of these things together, these end up being stressors on the body's health and consistency. So, you know, we're almost done here. We know we've got a lot that we're going to hear from you tomorrow at the Brain Health Summit, but let's have a parting thought from each of you.
Um, yeah, so I would say sleep. That was a good point. That's kind of one of the number one recommended things. If you can change anything, is try like love yourself first and give yourself that time to actually sleep, because there's actually a process that clears your brain that was recently discovered called the glymphatic system, and your brain pretty much like flushes and cleanses itself at night when you sleep. So yeah, super important, and pay attention to your health signals and your body and what it's telling you, and be proactive.
I think that it's important to remember that you have to be educated about signs and symptoms. You have to know to recognize, and that there are treatment options. We can make and prevent brain injury, and that it's important to initiate treatment earlier if we can. And the goal being to help people to return back to their activity levels as they are used to, as passionately as and as at the level that they're used to doing, and as safely as they can. So there's something we can do about it.
Well, thank you both for joining us. We appreciate you taking the time to be here with us on Radio Row. We look forward to the conversation tomorrow. On behalf of Sports Philanthropy Network, this is Roy Kessel signing off from Radio Row at Super Bowl 59 in New Orleans. Please remember to live generously.